Many folks have been told that one of the causes of their pain is scar tissue. So there's typically two main causes of scar tissue. One is people get scarring after surgery. The nice thing is there's injection techniques that you can do beside prolotherapy that gets rid of scar tissue. So the injection technique that we use in the office is called neural therapy, Neural therapy. So we inject Novocaine, Procaine, and we expand the scar from the inside. And then Procaine itself has some collagen relaxing effects. And again, it might be that, a person has to get 6 of those kinds of treatments. Typically we do them once a month. The neat thing is, if you can see the scar from the outside, that neural therapy will cause the skin to get a more normal appearance. So the person knows that the scar tissue is going away. The second main cause of scar tissue formation is that there's a lot of muscle or fascia contraction. So the fascia contracts and the muscle contracts typically to stabilize an unstable joint. Now I know there's other causes, like if somebody sits too long and they don't do any active exercise, they might get some scar tissue formation just because they're not active. But for the average active person that has a gristly sound, like you around your shoulder you got a gristly sound, or some other place, you got to think of what is going to be the ultimate cause of that scar tissue. And it's normally scar tissue is very taut. So why would the body want taut connective tissue? Why does it want taut connective tissue? It normally would want taut connective tissue because it's trying to stabilize an unstable area. So if you have taut connective tissue around your shoulder, you probably got shoulder instability from a labral injury or a glenohumeral ligament injury. If it's around your knee, which is very, very common, it's normally because you got knee instability. The other thing is often people get it in their foot. They get a lot of they get a lot of massages, and I'm not saying that massages for plantar fascia problems can't resolve it, but I think a better option is to try to regenerate the structures that's injured or degenerated with prolotherapy, because prolotherapy is a regenerative injection technique. So it stimulates the injured ligaments, tendons, fascia, meniscus, labrum to regenerate and to get stronger. So once those areas get stronger and the joint instability stops, then the muscles relax, the fascia relaxes. So long term, typically athletes and other folks, they don't need to keep going to get massage or massage themselves, it isn't normal to need massage per se. There's nothing wrong with getting a massage, but you shouldn't need to have to get massages or chiropractic care or whatever. The goal should be just have a nice life. So I like that prolotherapy has a lot of long-term lasting effects because it gets at the root cause of myofascial trigger points, scar tissue, tight fascia, and that's joint instability. Once the joint instability is resolved, the muscles relax and the person's fine, and then they just go about their activities.